Hello, this is Stacy, and I'm going to be demonstrating how to perform a pediatric physical assessment. So first I want to identify my patient. This is Gavin, and he is 8 years old. And once I've done that, I want to make sure that I maintain a calm, stress-free environment and establish good rapport with both the patient and the parents. I would get a full set of vital signs, so blood pressure, temp, pulses, all of that on the patient. And then I would do a general assessment. So I'm going to check for any signs and symptoms of distress, any shortness of breath, wheezing, coughing. I would check mobility. I would have the patient walk back and forth from the door to the bed just to check their gait. I would check their body structure for symmetry. And I would check their hygiene, their grooming. Are they maintaining eye contact? He is doing all of that. So then I would move on to the neurological assessment. So at this time, I'm going to see if my patient's alert and oriented. Gavin, can you tell me your full name? Okay. Where are you at? Perfect. And what year is it? Perfect. Gavin, are you having any suicidal or homicidal thoughts? Good. Awesome. At this time, I would go ahead and assess his head and his neck. So I'm going to do his head circumference. Is there anything asymmetrical on his head, his face, his skull, his eyes? I would check, are his pupils equal, round, reactive to light? So I would use a pin light that I don't have, but I would use a pin light. Check that his pupils are equal, round, reactive to light. I would then move on to his ears and check his ears for any earwax, any type of drainage that shouldn't be there. I would perform a whisper test. So I would stand behind the patient. I would whisper a word, and then I would have the patient tell me what the word was that I said. So I would then move on and check his nose for any drainage and check his throat. How's his swallowing? Does he have any drainage down his throat? I would then do a cardiovascular assessment. So I'd grab my stethoscope here. I'm going to listen to his heart sounds. So I'm going to be listening to aortic, pulmonic, tricuspid, and then mitral. Everything sounds good. I would check his chest circumference with a measuring tape. So I would go all the way around at the nipple line, check his chest circumference. I'm going to check his pulses. So let's start with the pedal pulses in the foot, radial, carotid, and then I would check his capillary refill in his fingers. So that looks good. And like I said, I took his temperature and everything earlier. His skin is pink, it's warm. Everything looks good there. So then I'm going to move on to a respiratory assessment. So I'm going to grab my stethoscope again. Now I'm going to listen to lung sounds. Now his lung sounds, there's going to be 10 anterior, 4 lateral, and 10 posterior. So I would listen to all those. I would listen on his back. And obviously I'm going to be checking like the quality of his respirations. Are they even, unlabored, all of that. And then is he coughing? Any issues with that? Any sputum? And Gavin, are you coughing or having any sputum production? Are you coughing anything up? He said no, so that's perfect. I would then move on to his belly. So before I do anything, grab my stethoscope again, and I'm going to listen to his bowel sounds in all 4 quadrants. Everything sounds good. It's active. Gavin, when was your last bowel movement? Yesterday. That's perfect. Are you having any constipation, diarrhea, any sudden changes in your bowels? No? Perfect. Any nausea, vomiting? Okay. Are you having any loss of appetite or change of appetite? Perfect. I would inspect his abdomen for any distension or anything like that. Everything looks good. He's soft and it looks good. So then I would move to his genitalia, ask him, are you having any issues with any rashes, lesions, any discharge that shouldn't be there? He says no, so I would move on to urination. Gavin, are you having any issues urinating, any pain? Are you having any cloudy urine? Okay, perfect. I would then move on to his musculoskeletal. I'm going to check his symmetry on both upper and lower extremities, so I would make sure that everything is equal on both sides. I would also test his strength, so he can grasp my hand. Gavin, grasp my hand for me. Perfect. And I would have him dorsiflex and plantar flex his feet. I'm going to lift, or can you lift your leg up? And I'm going to push down and just push against my hand, checking for resistance. That's perfect. I would do that with both legs. Perfect. I would check muscle tone. I checked his gait earlier. He walked back and forth from the door. Any range of motion issues, so I would have him move his arms and his legs to see if there's any range of motion. Gavin, can you lift your legs up in the air for me? Perfect. And we would test abduction by moving his legs out to the side. Perfect. So everything looks good there. And now we're going to assess skin turgor. So on his chest, I would just kind of pinch up and assess his skin turgor, which looks good. I would assess for any edema in his legs, any edema anywhere. His feet, everything looks good there. I'm going to assess for any skin breakdown. I'm going to assess his heels, his feet. A lot of times, with especially people that are bedridden, they can have skin breakdown on their heels. But he looks good. He's active. There's no issues there. I would assess his full body. I would assess from head to toe, front and back. So I would check his backside, the back of his body, everything. And then I would check his, if needed, if there was a reason for it, I would check his perineal area. And after all this is done, I would document and record my findings.